I really would like to begin by thanking the legislature for the tremendous support for funding the cardiac project over all of these years. And I would hope that you would find that it's an investment that has been well worthwhile, but no other state that I know of has made an investment of this kind using state funds. And I'm very thankful, and I think hopefully it is making a difference to children and families. So thank you. As I said, we began 16 years ago. The first county in which cardiac screening occurred among fifth graders was in Boone County at Sherman Elementary, which you just heard mentioned by Kate. Dr. Stallings was with me that morning, and sometimes people ask, well, why did you start in Boone County? And when you want to start a new program, particularly one that involves working with children in the school environment, and one in which, as you'll see, we draw blood on these children to make some measurements. You want to do it where hopefully the superintendent of schools can have some trust that what you're going to do is worthwhile. And the superintendent of schools at that time in Boone County was Dr. Stallings' patient, and that certainly helps. So you want to start where you're likely to succeed. And Ron, thank you for being there for us. We've screened now over the years over 150,000 children. Now some of these are second grade children who have BMI screening alone without blood tests. And during the first several years, we did on the fifth graders finger stick checking for blood cholesterol. And so the data that I'm going to report to you actually begins in about 2003 as opposed to 1998 when we first began, because in 2003 we transitioned to doing venipunctures, regular blood sticks, for more accurate and frankly less expensive measurements of blood cholesterol and other things we measured. And initially, the school nurses told us, you can't really draw blood in the school environment. But it actually, one of our area coordinators managed to do that working with the school nurses here in Kanawha County. The students and their parents and so forth seemed to accept it just as much as a finger stick. And the problem with the finger sticks is that health science students from around the states were the ones that were doing it, working with our staff and with school nurses. But there's nothing intuitive about how to do a finger stick right. And so we wondered about the accuracy. If you don't stick well enough or deep enough, and they're squeezing real hard, you're getting tissue juice out and so forth. So we just found that the venipuncture, the way they do it in a clinical lab and so forth, is far more accurate, and it's been just as accepted. So over 90,000 children now have had, over this time, complete comprehensive screening, which consists of not only a health history regarding cardiovascular disease and diabetes, but a family history, but also measurement of body mass index in a confidential sort of environment so that it's not embarrassing to the kids, a measurement of blood pressure, and then a blood test for fasting lipid profile, cholesterol tests, and we also screen for a rash on the back of the neck called acanthosis nigricans, big Latin word, but it really is a hyperpigmented rash that when present suggests the possibility of insulin resistance or prediabetes. And when that's present, we also measured glucose and insulin to try and document whether in fact that was present or not.